Welcome to the Health is Wealth channel. We are going to explore the brand new syndrome that the American Heart Association has just identified called CKM. It is estimated that a whopping 1/3 of all Americans have some degree of this syndrome. Could it be you? If so, what should you do? How will it affect you? How concerned should you be? Well, stay tuned for some information that is fresh off the press just for you. Here at Health is Wealth, we try to keep you informed and give you the most up-to-date information that you need to ensure that you and your chosen physician can have the most meaningful and productive conversations, so that you achieve and remain in the most healthy state that your body can be at this moment. Remember that health is a lifelong journey, and we at Health is Wealth are committed to walk alongside of you on this journey. So what do the letters CKM stand for? CKM stands for Cardiovascular Kidney Metabolic Syndrome. Wow, that's a mouthful, right? Let me break it down for you. Cardiovascular Kidney Metabolic Syndrome basically speaks to the relationship between obesity, type 2 diabetes, chronic kidney disease, and cardiovascular disease. Obesity is defined by the World Health Organization as having a body mass index above 30. Obesity has become an epidemic in America and is spreading like wildfire throughout the world. The latest data shows that almost 40% of Americans are classified as obese. There have been a ton of studies and speculations as to why this is. Could it be our sedentary lifestyle? Could it be our sugar-laden diets? Could it be lack of proper sleep? Could it be simply genetics? Unfortunately, there has not been a conclusive answer to that question yet, and so Americans continue to suffer from obesity. CKM identifies the crucial interaction between these disorders. Studies have shown that one of the risk factors that comes from being obese is the increased possibility of developing type 2 diabetes. Diabetes is a chronic disorder where either the pancreas does not produce enough insulin, or the body does not use that insulin properly. There are two types of diabetes, type 1 and type 2. Type 1 diabetes usually is noticed early in life, as the pancreas does not produce enough insulin. With type 1 diabetes, there is the necessity to regularly supplement the body's insulin levels mostly by injecting insulin daily. With type 2 diabetes, the body tends to not use the insulin that the pancreas produces due to excess glucose in the body. Type 2 diabetes can greatly damage the nerves and blood vessels. The cardiovascular system is comprised of the heart, nerves, and blood vessels. Are you getting it yet? Can you already see how interdependent these disorders are? Well, now let's look at cardiovascular disease. Cardiovascular disease can be defined as stroke, coronary heart disease, aortic disease, or peripheral arterial disease. Strokes happen when the blood flow to the brain is interrupted or stopped. Peripheral arterial disease happens when there is blockage in the arteries that supply the limbs. Usually the blood flow to the legs is interrupted or stopped. Aortic disease is often seen as an aortic aneurysm where the aortic wall bulges due to weakness. Coronary heart disease is when the blood supply to the heart becomes blocked or significantly decreased. Cardiovascular disease is something that everyone should take very seriously as the consequences can be severe. Coronary heart disease can lead to heart attacks, aneurysms, and strokes that can then lead to death. We still have one more component of the syndrome to discuss: kidney disease, specifically chronic kidney disease. In chronic kidney disease, the kidney's ability to filter blood has become impaired due to damage to the kidneys. The result is that fluid and waste remain in the blood and can cause heart disease and stroke. Do you see how intertwined all of these disorders are? It makes you wonder why these connections weren't made before. Well, thankfully, the American Heart Association has not only made those connections, but they have provided some meaningful tools along with them. You see, they not only created a syndrome, they created a scale for us to use. In this scale, there are 5 possible stages in which everyone can be classified. As we discuss them, try to identify the stage that you are currently in. Stage 0 is the optimal stage. In stage 0, there are no risk factors and everything centers around prevention. This is vital as one of the other things these disorders have in common is that they are mostly preventable with just lifestyle and diet changes. Did you get that? Your choices control whether or not you progress up the scale. Let's all make the right choices to live a healthy and wealthy life. That would include eating right, exercising regularly, maintaining a good sleep schedule and regular screening. Stage 1 is characterized by excess body fat, especially abdominal fat, prediabetes or impaired glucose tolerance. The recommendations would include eating right, exercising regularly, maintaining a good sleep schedule, regular screening, a weight loss goal of 5% along with glucose treatment as needed. The goal of stage 1 is to move down to stage 0. Stage 2 is characterized by kidney disease, type 2 diabetes, high triglycerides or high blood pressure. The recommendations would include eating right, exercising regularly, maintaining a good sleep schedule, regular screening, a weight loss goal tailored to you, and you can expect your physician to prescribe medicines to control the disease. The goal of stage 2 is to move down to stage 1. Stage 3 is characterized by early cardiovascular disease or kidney disease with a high risk for cardiovascular disease. The recommendations would include eating right, exercising regularly, maintaining a good sleep schedule, regular screening, a weight loss goal tailored to you, and you can expect your physician to increase the dosage of your previously prescribed medicines or switch medications in an attempt to control the disease. The goal of stage 3 is to move down to stage 2. Stage 4 is characterized by systematic cardiovascular disease, heart attacks, stroke, metabolic disease, with or without kidney failure. Things are very serious at this stage, so while the recommendations would include eating right, exercising regularly, maintaining a good sleep schedule, regular screening, a weight loss goal tailored to you, you can now expect your physician to create a personalized treatment program to attempt to control the disease. The goal of stage 4 is to move down to stage 3. Hopefully, this video has been informative about the interplay between the various diseases and how one disease can open the door for the others. As you have seen, the best recommendations for them all is taking good care of yourself, eating a healthy diet, maintaining a healthy weight, getting appropriate sleep and exercise, and of course meeting with your physician regularly to know what is happening in your body and to come up with effective plans for addressing any problems. Remember, we only get one body, so let's do our best to keep it as healthy as possible. If you like this video and want to see more, please subscribe, like, and share. As always, we welcome your comments and feedback on what you would like to get more information on in future videos. Check out the info section of the video for the links to the American Kidney Fund and the American Heart Association, my two main sources for this video. Because here at Health is Wealth, we are here for you, to empower you with information to be the healthiest you possible.